So when we talk about obesity, the current definition, according to the Obesity Medical Association, is that the obesity has not one reason. It's not about eating more or moving less. It is multi-factor. It does have neurobehavioral effects. So neuro means your hormones, your appetite, and then of course, what is outside, behavior. And that is causing increase in the fat cells, and these fat cell dysfunction is impacting at the three domains, three aspects of your life: metabolic derangement like sugars, cholesterol, kidneys, uric acid, that sort of a thing; psychological, if it's giving you sleep issues, depression, anxiety; and mechanical, knee pain, back pain, heartburn, sleep apnea. So if it is affecting, so it's not about a person who can be, a little bit overweight, but if he has weight related knee pain, yes. But some patients are really, overweight, and they don't have the metabolic aspects to it, so the treatment will be different. So it's not about numbers anymore. So what currently, and I think we're very blessed to be in Canada actually came up with its own first guideline. All of these organization, either it's Canadian Medical Association, American Medical Association, they consider obesity just like diabetes and blood pressure. It is all across the age group, developed, undeveloped countries. In fact, the Stat Canada says that 1 in 4 in Canada suffers from obesity. So if you have 4 people in the room, one would be an overweight and obese people. But do you see any number in the definition? That your weight should be certain, your BMI should be certain?
No.
Yeah. So here's the thing. So obesity is very complex. It is progressive. It needs medical help. It needs medical attention. So what I want you to understand that obesity it's really think like it is a medical condition. As long as you do the treatment, you'll get results. Once you stop the treatment, it will come back. Some things are in your hand, something is not in your hand. It does inherit it in our gene. These genes of weight are centered in our brain. It does influence by the environment, and it will get worse over time. So that's very important to manage it appropriately. And it does require treatment. So eating less and moving more can work for a few months, but there are more to it. So the concept of eating too much, exercising less, or having low willpower, lack of willpower, it's a myth. That does not cause weight gain. In fact, research have shown that people who suffer from weight issues, they have the most stronger willpower. It's not an issue of person deficiency. So blaming the patient, have you ever blamed the diabetic? Have you ever blamed a person who got a cancer? Have you ever blamed a person who has hypertension? We never do, right? Have you ever done it? So why this? So I want you to start thinking that weight, yes, there are certain things that we need to change in our lives, but most of the things in the weight, it's not in our control. Does that make sense? Does that answer most of the journey that the people struggle with, right? Because sometimes we are very hard on ourselves, right? And we say that we do the diet for like 1 or 2 weeks, and then if we give up, and then what do we say to ourselves? That I don't have strong willpower, right? It's a common thing.
Yeah.
So it's not about willpower. So I will explain it to you. So one of the things that I do with my patients is like a body image thing, because people want to treat a number. People want to get a particular figure and stuff. Actually, we have to work on a realistic goal. So Barbie image or Barbie figure or decreasing the number, this is actually not recommended anymore because it is unrealistic. So using these vocabularies, we usually don't encourage it anymore. In fact, the first thing that when I will meet you, and in fact, I'm saying you that I'm not here to treat any weight numbers on the scale, because you will do whatever thing, but the weight will get stuck at some point in time on the scale. And then this causes frustration. But as long as your behavior is good, you have a positive outlook of your life, you are feeling a difference, you are improving your health and functional well-being, that's what it counts. So the concept of that overeating causes obesity is wrong. So eating more, moving less causes weight gain. That is a wrong concept. In fact, it's opposite. A person who is overweight, that causes him to eat more. Okay, and I can help you understand why it has happened. But the goal here is not weight loss anymore. This is the current guideline, and that's what the future looks like, that if we can teach our kids or adult when they're reaching that adulthood, maintain the weight. What if we were like 20, 25 before marriage, if we were able to maintain the weight, would we be here sitting, right? So concept of weight maintenance is the key. You lost 2 pounds, 3 pounds, 4 pounds, maintain. Weight loss comes after that. Because if your scale is already imbalanced and you're gaining every month, every 3-4 months, every year, weight loss not going to happen. You have to stabilize your scale first and then look down. So this is the key thing that I will be talking to you all. So I commend more on my patients that weight maintenance